Well, thank
Yes.
you all so much for joining us this morning. I'm so excited for this event and to share this wonderful topic with you all today. My name is Leanna Bennett. I am a National Walk Manager with the Lupus Foundation of America. I support our DMV region and I'm so excited to share this Saturday morning with you all. I hope you guys enjoy the talks. I'm personally so excited to hear from all of these speakers today. First, I would like to thank our presenting sponsor, GSK. They are a wonderful partner and support many aspects of our organization. And we are just so grateful for them. So thank you so much, GSK. And we have a wonderful patient engagement liaison here with us today to share a talk and some tools with you all. I wanted to first start with some housekeeping items to go over. If you have any questions at all, please submit them to the chat. We will have time at the end to share your questions and discuss all of those. Don't forget to keep yourself muted. That just allows for a more seamless presentation. And then if you are more comfortable at the end, feel free to unmute yourself and we can ask a question that way if the chat box is kind of too hard to get your question across. And then finally, this program will be recorded. So if you see topics that you really, really enjoy and you want to go back and listen later, we will share the presentation at a later time. Just getting more in. Perfect. This is the brief agenda above. I will start with a brief LFA overview, just sharing resources and tools. We have a wonderful lupus warrior here with us today who will be sharing her perspective. Dr. Rebecca Manno will share the presentation on Lupus and Exercise. And then finally, Arnita Roberts-Christie will share Living with Lupus, a presentation from GSK. And then we'll have some time at the end for some questions. All right, so let me go ahead and just get started now. Let me just make sure everyone is in. Perfect. All right, so people affected by lupus really are the heart and soul of our foundation. You are the central focus of everything we do and are a constant reminder of our mission's urgency and serve to motivate us to continue our fight. And really, to put this simply, our goal at the Lupus Foundation of America is to one day end the impact of lupus and its suffering while ensuring that we provide the comprehensive support and programs people with lupus need today. Our programs stand upon 3 pillars: research, care, and support services, and advocacy. We have redefined lupus research to expand our efforts beyond just funding research grants. We are engaging all stakeholders to identify barriers that stand in the way of progress and setting a course to overcome them. And we do this by providing caring support for people affected by this devastating disease and leading advocacy efforts to bring more funding for research and services. We are patient-centered and focused on transforming lives. We have 3 goals: so identifying causes of lupus, discovering better ways to control symptoms, and ultimately find pathways to a cure. So we have really great programs here at the LFA that can help. People with lupus are so important to the research process, and that's why we developed our new online research platform called RAY. RAY stands for Research Accelerated by You. And no one understands lupus better than those living with it. You can help advance lupus research right from the comfort of your home by participating in RAY. You can share your experiences with lupus to help inform future clinical trials. And you guys are really helping identify the most pressing needs of people with lupus. It's a new program that's really, really cool. We also have a National Research Center on lupus, which is your one-stop resource for all things lupus, from treatment to living and coping with the disease. If you head to lupus.org/resources, you can find all of our great resources organized right there on our website. We also have amazing certified health education specialists who are trained to provide people with lupus, their families, caregivers with non-medical counseling, disease education, and helpful resources. Our health health educators can help you find trustworthy information to answer your question about lupus and how to cope with it all. You can contact our health educators by heading to the lupus.org/health educator, and you can fill out a form and they will reach back out to you to provide you with the best support. We also have a program called Take Charge. It's a 12-week education email series for people with lupus. When you sign up, you'll receive an email from our health education specialists with tips and resources that can empower you to take charge of your health. The series covers so many important topics, and I think it's a really great for keeping people on track and managing their disease. We also have an amazing podcast called the Expert Series. It's a monthly educational podcast where we bring experts to the field to discuss topics that are important to you. I personally love podcasts. It's such a great form of media to learn. You can listen to it while you walk, and it's such an informative tool, and we have some really amazing topics and speakers. We also have more than 150 support groups across the country where people can come together and ask questions and listen to others. Right now, a lot of these are happening virtually, which is still great because we're able to still reach the community and provide support for everyone. And finally, we have Lupus Connect, which is our online support community where members can engage with each other and be a part of the community and ask one another questions. Now we have ways to get involved with our organization and support. We have our Walk to End Lupus Now program, and it's really exciting. This year we'll be back in person. So if you head to walktoendlupus.org, you can find a walk near you. We also have virtual options for those who are interested. Feel free to jump in the chat and I can help send links or resources or more information on that event. We also have a program called Make Your Mark. It's a way you can turn your community event into a fundraiser. And then finally, we have our advocacy program. Using your voice is one of the most powerful tools, and by becoming an advocate, you can use your voice and get in touch with your local legislation to make real change. Also, this June, we have a virtual advocacy summit. Registration is now open, and I can add the link into the chat after this presentation. It's a great way to connect with other lupus warriors and really make a difference on policy. And we also, as you know, I mentioned in the beginning, I
listening to a podcast, not a podcast, a live stream. Lupus.
All right.
And
if you wouldn't
exercise.
Mind muting.
And there's different programs they have to deal with it. So what I'm thinking of is, and this is a stone thought.
Sir, can you hear me? Would you mind muting yourself? Thank you so much. Perfect. We also have chapters all across, so please let me know if you need any assistance finding an individual who can help find you all your resources you need. As I mentioned, I oversee your DC, Maryland, and Virginia regions, but I can help put you in contact. I know we have people from all over here today. And here is all of our social media. It's a great way to stay updated very quickly on programs, services, events, and it's just a really great way to connect with others. And we share things so quickly up on our social medias when new treatments are founded, the policies are updated. So make sure you connect there. You can also share this slide and connect with you all in the chat during the presentation if you have any other questions. But without further ado, I would love to introduce our next speaker. Thank you all for listening to me. I'm so excited to kick this off with an amazing speaker. We have a wonderful lupus warrior here today, Rachel, and we are so thankful for you joining us this morning and for your openness and sharing your story. So I'm going to stop sharing my screen now and turn it over to you, Rachel.
Hello, good morning, everyone. Thank you for the opportunity to speak with you today. My name is Rachelle Goins, and I'm a fellow lupus warrior. I'm also a personal trainer and nutrition coach. I wanted to share a little bit of my story and kind of tell you how big of an impact exercise has been on my life since developing lupus. I had my first flare-up in 2015 during a big transition in my life. I had just graduated from college. I'd moved to a new city and started my career. during this flare-up, I had a wide array of symptoms, but the most impactful was an extreme level of fatigue and gradual pain that eventually led to difficulties walking. Up until that point in life, I had never experienced any health issues, and I was pretty unfamiliar with lupus and autoimmune conditions in general. This flare-up lasted just over 6 weeks, and during this time, I saw 5 different doctors and went through quite a bit of testing. None of the doctors were able to pinpoint the issue, and after each appointment, I was sent home without an answer and nothing to manage the pain or the fatigue. This was probably one of the lowest points in my life. I didn't have any family living nearby, and felt pretty isolated, and a little unheard by the doctors that I was visiting. So my days were spent either in bed or just seated at my work desk. The pain and the other symptoms eventually faded, and my energy levels returned to normal. And I kind of just chalked it up to a strange infection and assumed it was a one-time thing. At that time, I didn't know it was going to be an ongoing issue. But what I did know is that I never wanted to experience that again. And so my biggest takeaway from that flare up was that health is pretty fragile, and at any moment, good health could be taken from us. I didn't like that I felt so out of control with what was going on in my own body. And at that time, I had very limited experience in exercise, and I hadn't played a lot of sports growing up. But I knew that I wanted to make some sort of a change. So within days of that flare-up ending, I started exercising by going on short runs a few times a week, just to kind of get started. And then eventually started going to some group fitness classes and lifting weights. There was a lot of trial and error and learning and figuring out what worked for my body and what I needed. And everything was going well until about a year later when my symptoms started to reappear. So long story short, I saw a new set of doctors and did receive my lupus diagnosis. And after receiving that diagnosis, I went through a little bit of a mourning period. But my saving grace was going to the gym and being able to move my body in kind of just any way that I could. So for me, I found that exercise benefits me mentally just as much as it does physically, and which is one of my biggest motivators. So not only does it give me more energy, but it also helps clear my head and gives me perspective. Because with lupus, some days are fantastic and I can get through some really tough workouts and like do a lot of fun things. But others, a long walk is all that, that I can handle, or that's what's needed for me. So at this point, it's been 7 years, and I believe that my lifestyle changes have had a big impact on how lupus affects me day to day. I've been through long periods of time without any symptoms or complications, and I've seen the best results in my health when I'm consistent with my exercise habits. So I think when we take the power back from our lupus diagnoses and use it to work on ourselves, I believe the results really can be life-changing, not only in our health, but in all areas. So I think to folks, I just want to emphasize that if you are ready to start a health or like a lifestyle change, to start small. And I encourage everyone to try a little bit of everything, find out what you enjoy and get help if needed. I know for me, when I started working out, there were a lot of like ups and downs and trial and errors, and I didn't have a lot of guidance, which is one of the reasons that I went on to become a trainer and a health coach, just so I could help others in a similar situation. But I've seen the benefits that working out and staying consistent has had on my lupus condition. So when, using exercise to manage my condition, I have more energy, I'm stronger, and I move better overall. So again, I encourage everyone to get active, and because it truly is life-changing, especially for lupus. So thank you all for letting me share my story.
Thank you so much, Rachel. It's always so wonderful to hear such a positive outlook and all of your advice. If you guys have any questions for Rachel, feel free to keep them in your head, write them in the chat, and we can get to that later. And I'm just so inspired by you, Rachel, and I am thankful and looking forward to getting to know you more.
Absolutely.
So next, I am so excited to introduce our next speaker. We have Dr. Rebecca Manno. She is a rheumatologist with clinical and research experience in exercise and nutrition. She completed rheumatology fellowship training at the Johns Hopkins School of Medicine, where she continued as faculty for over a decade until moving to the U.S. Virgin Islands to start a rheumatology practice in the Caribbean. She currently is the director of the Arthritis and Rheumatology Center of the Caribbean on St. Thomas and St. Croix, and the only full-time rheumatologist in the U.S. Virgin Islands. She maintains her affiliation with Johns Hopkins as an adjunct assistant professor and is passionate about caring for patients with lupus and other rheumatic conditions. Her practice places a great deal of emphasis on the importance of nutrition and exercise, in addition to pharmacotherapies in the treatment and prevention of rheumatic disease. So thank you so much to Dr. Manno for joining us today. If you wanted to share your screen, that would be wonderful.
Great. Thank you so much for the introduction, and thank you for the opportunity to speak with you this morning. And thank you, Rachel, for that amazing story and testimony about your journey. And it's beautiful, it's inspirational, and thank you for that too. All right, so we're going to spend the next 20 minutes or so talking a little bit about exercise and lupus. But first, just so you know a little bit about where I am right now in the world. So I am currently in St. Thomas in the U.S. Virgin Islands. And if you're not familiar with the U.S. Virgin Islands, we're located right here, just to the east of Puerto Rico. It's about a 25-minute flight between the two islands. So the U.S. Virgin Islands is made up of 3 islands, St. Thomas, St. John, and St. Croix, and we're right next to the British Virgin Islands. There's St. Thomas, St. John, and St. Croix. So I live here in St. Thomas, and that's the view that I get to see every day that I am blessed with. I work here in St. Thomas, right in downtown Charlotte Amalie. And once a week, I take a little teeny tiny plane over to St. Croix. And so my commute about once or twice a week looks like this. So it is wonderful. It is complicated being in the world of limited resources, but I feel very lucky. So I think, and I share this with you just as a reminder to really embrace your lupus community, not only in Baltimore or whatever city or town that you're in Maryland, within your state, but also globally. We, and I use the communal we, both doctors and patients are going to be stronger working together. And we really are a global community. So at the start of every academic talk, we always give disclosures. And I will tell you, I do not have any disclosures, but I do have one, which is that I will not be discussing nutrition today in the interest of time. And that's an important disclosure because whenever I'm talking about exercise with my patients, and depending on what goals are, nutrition really goes hand in hand with that, especially depending on what goals you're trying to achieve. So nutrition is a whole nother discussion that I love talking about as well, but I'm not gonna be talking about it in the next 15 minutes, but it's just as important as exercise. So here's a fact that I often put on the screen when I give talks about exercise to my physician colleagues, and everybody in the room nods their head and we say, yep, exercise is good for our patients. And we sort of take this as fact, but I always think that it's important if we take something as fact to know where we are coming from. So I just want to spend a minute talking a little bit about a brief history of fitness. So if we go way, way back to early developmental humans, really when humans were hunters and gatherers, there was no opportunity to be sedentary. You had to be out there, you had to get your food, you had to be active. But even as early as 200 BC, and some of the earliest scientists and physicians have taken note that being active was beneficial to health. And Hippocrates has, in his writings, has written, eating alone will not keep a man well. He must also take exercise. So it was recognized even then that the body is meant to move. Then we had the Industrial Revolution, where no longer did people have to be out there hunting and gathering, but we started to develop machines to do things that humans were doing previously. Then we had 2 world wars, which just changed everything. And around in the 1920s, around 1928, 1930 or so, penicillin was developed. And that's important because some of the biggest causes of morbidity and mortality for humans went from being infectious diseases to chronic diseases. People were living longer. So we were seeing the emergence of other types of health issues and had to rethink about how to treat and prevent them. In the 1950s, there was a really interesting and seminal study that was done by an epidemiologist in London named Jeremy Morris. And so if you've ever been to London or the UK, you've seen these double-decker buses. And what Dr. Morris observed was that there are 2 staff members on each bus. So 2 people staffed these double-decker buses. There was the driver who sat and drove all day. And then there was a conductor who ran up and down the stairs and collected fares from everyone on the bus. And what he observed was that the drivers had a several-fold times higher risk of developing cardiac and heart disease and having heart attacks and strokes compared to the conductors who ran up and down the stairs all day. And this started the scientific data that said, hey, exercise is doing something. It may be actually preventing what we were seeing, such as cardiovascular disease, being a major cause of morbidity and mortality in people. Then we had the invention of computers, so people became chained to their desks even more, and we had machines doing more and more and more for us. In the 1960s, we really started with exercise in the commercial world, and this was one of the earliest exercise books, which was about aerobics by Dr. Kenneth Cooper. Then we started having a lot of commercial exercise programs and really exciting workout programs that were accessible to everyone, such as Richard Simmons. In the 1980s, you had the explosion of commercial gyms like Gold's Gyms and new types of exercise classes like spinning. And in the 1990s, the US government actually and the Surgeon General started to recognize, hey, we should make some recommendations about physical activity and health. And they came out with the first report from the Surgeon General about recommendations for physical activity and health. And that wasn't until 1996 that actually happened. Then we had the World Wide Web, which changed everything because now we had the internet and accessibility, not only of information for people everywhere, but also resources for exercise. In the 2000s, you have the explosion of high intensity training, dance training, all sorts of options were available. And finally, in 2008, the Surgeon General updated the physical activity and health recommendations. And these are still the current recommendations for today, which is 150 minutes per week of moderate intensity physical activity, which is about 30 minutes per day, 5 days a week. And it includes muscle strengthening at least 2 days per week. So we got beyond just the aerobics component of exercise. Finally, in 2018, we have the second edition of physical activity guidelines. And I just want to point out some of the key guidelines for adults. So in general, some physical activity is better than none. Adults should still do greater than 150 minutes, which is a week, or at least 75 minutes of vigorous. So 150 minutes of moderate, 75 minutes of vigorous, and additional health benefits can be gained with additional activity. And once again, emphasizing the importance of muscle strengthening activity. There is a specific section for adults with chronic health conditions, which is all of our patients with rheumatic disease, and the recommendations are the same, but even more strongly emphasized. And most importantly, the emphasis is on avoiding inactivity. So as we move forward in our history of fitness, in 2019, we started to have all sorts of devices to track your heart rate, to track your sleep. We had Fitbits, we had resistance bands, we had all kinds of new, interesting types of fitness that have emerged in the commercial scene. And then there was COVID in 2020. And truthfully, that changed a lot of things. It was harder to work out in gyms. You couldn't work out in gyms. You had to get creative or give up and not do anything, which was definitely the wrong thing to do. So, but in many ways that opened the door in 2022 and beyond to different types of exercise. We have a lot more home-based exercise programs, a lot more outdoor work that can be done, and the future is, the sky's the limit as to what the opportunities are. So now when physicians say exercise is good for our patients, we really have a sense as to where this recommendation is coming from. And once again, we all believe that that is true. But this statement is also equally as interesting and important, which is exercise is good for our patients' doctors. So why do we care if physicians are exercising? And does it matter what the exercise habits are of physicians? And I think these are some interesting data. So they did a study looking at Harvard Medical School faculty, and they said, how often are you exercising? And less than 50% of them were exercising 1 hour per week. Well, you might say, well, it's really cold up in Boston. I don't know. They're staying inside all the time. It's probably just, it's a Harvard thing. So they asked the same study of physicians in California, and they found that 73% of California physicians were exercising less than an hour per week. So still not very impressive numbers. So who cares if your doctors are exercising? Well, we should care because it does impact how physicians are then instructing their patients on exercise and nutrition. And so this was a study looking at physicians and what their habits were in terms of instruction on exercise. And so doctors who exercise aerobics exercise regularly were 5 times more likely to recommend aerobic exercise to their patients. Physicians who strength trained were 4 times more likely to recommend strength resistance exercise to their patients. And interestingly, older age and longer time in practice was negatively associated with exercise counseling. And I think this was a reflection of some of the old-fashioned teaching in medical schools and so on, where exercise and nutrition was not, an emphasis was not placed on those as part of of overall health and recommendations. And that really is starting to change. And it is a huge benefit that it is. Some of the barriers that physicians would cite in terms of their limitations in counseling patients on exercise: inadequate time, inadequate knowledge, concern that patients were not interested, or just a lack of having the data of the benefits of strength training. And this is important because up to 80% of the population relies on their physicians for recommendations for physical activity. And so it is up to us as a medical community to make sure that we are spreading the knowledge and the data that are out there about the benefits of exercise. But I also empower patients to ask their physicians about these things and to push them and to challenge them about it because it is such an important part of overall health. So I like to think about a prescription for exercise because I like to think about it just as we write prescriptions for other medications such as hydroxychloroquine, mycophenolate, prednisone. We should be writing prescriptions for exercise as well. And when we think about exercise, we should think about a very specific definition. There is a difference between physical activity and exercise. And the difference is this: physical activity is anything, any sort of movement, anything that you're doing. Going to do laundry, going to the grocery store, these are all physical activity. When we think about exercise and we talk about exercise and we talk about the prescription for exercise, it's very specific. It's a subset of physical activity. It's planned, it's structured, it's repetitive, and it's goal-oriented. Now, that doesn't mean that it has to be high intensity. That doesn't mean it has to be for 6 hours a day, but it's planned, it's structured, it's repetitive, and it's goal-oriented. And that is specifically exercise. And that could be even 5 minutes a day. But that really is how the benefits of exercise are achieved. So as we get onto a prescription for exercise, a resource that I'd encourage you to check out is the Exercise is Medicine website. So this was an initiative that has been out for several years at this point by the American College of Sports Medicine, that is both for patients and physicians about how to prescribe exercise. So once again, I always empower patients. If your physician is looking for resources, this is a great one, the Exercise is Medicine website. It is updated regularly and there's a ton of great information. The vision of this initiative was to make physical activity and exercise a standard part of disease prevention and treatment in the medical paradigm in the United States. It has gone through several iterations, and it includes exercise information with a multitude of chronic diseases. I will tell you that lupus is not currently one of the chronic diseases on the Exercises Medicine website, but they do have exercising with arthritis. And as arthritis plagues many of our patients with lupus, I think there's some very valuable information that is there. But I think that there's a really interesting and universally applicable piece of advice that I've taken from this program, which is the 4 steps to starting any exercise program. Now, of course, they say that these are guidelines for healthy adults under the age of 65 with no chronic diseases or conditions, which is basically no Americans at all. So step number 1 is set aside time each day to exercise. This is have the dedicated time. It doesn't have to be a lot of time, but put aside this time for yourself. Step 2, choose cardiovascular exercises that you enjoy. Walking is a great way to get started, but it has to be something you enjoy. If you hate running, don't run. If you hate biking, don't bike. If you hate walking, don't walk. Look into swimming, look at the elliptical, find something you like. If you don't like it, you won't do it. Step 3, start with a small amount of time and then gradually build up. There is no time that is too small if it's consistent. And step 4 is incorporate strength training into your routine. So by building muscle, you will see the most benefits from exercise. And resistance training doesn't need to be with heavy dumbbells at the gym. It can be body weight resistance. It can be static resistance exercise. So what do we know about exercise in lupus? And I will tell you, in general, this is a very understudied area, and I hope that we have more to talk about this in the future. But there was a nice systematic review and meta-analysis, which is when the authors of this study go and they look at all of the studies that have been done on exercise and lupus over a period of time. This systematic review looked at all of the published studies between 1989 and 2016 that had more than 5 subjects and an exercise intervention. There were 7 studies that included aerobics and resistance exercise. And what they found was that exercise was not associated with flares in lupus. It did provide the same known cardiovascular benefits that we see in non-lupus patients. We saw improvements in fatigue and reductions in depression. So this is a very interesting and important topic, which is exercise and inflammation. We know that there are anti-inflammatory properties of exercise, and this is a bit counterintuitive because initially during exercise, pro-inflammatory proteins are increased. And this is why there were some concerns that, well, maybe since we're increasing pro-inflammatory proteins, we're going to worsen autoimmune diseases like lupus or rheumatoid arthritis. But the data suggests otherwise. And the reason it suggests otherwise is because after exercise, inflammatory proteins decrease. So the net gain is an anti-inflammatory effect. Most of this work has been done in the inflammation associated with aging. We still have a lot of work to do in autoimmune and inflammatory conditions. This was a nice study that was done specifically looking at inflammatory cytokines or proteins made by the immune system in lupus before and after exercise. It's a small study, but I think this is the tip of the iceberg of what hopefully we can understand better in the future. They looked at, this was only 8 patients, and they had 12 weeks of twice a week supervised exercise. And what they did was compare inflammatory cytokines or proteins that are made by the immune system that cause inflammation before and after the exercise program, the 12 weeks. You can see the lupus patients in the black and the gray bars before the exercise program, and in the black bar, and in the gray bar after the exercise program. The white bars are healthy controls. So you'll see that, and each one of these graphs is a different inflammatory cytokine or protein. And what you see is that compared to healthy controls, the lupus patients had higher inflammatory proteins overall. But after the 12-week exercise program, each one of those inflammatory proteins was decreased. What about the cardiovascular benefits of exercise in lupus? We know how important it is to protect the blood vessels in lupus and cardiovascular health. So this was a study that looked at 12 weeks of aerobic exercise on arterial stiffness, inflammation, and cardiorespiratory fitness in lupus. This was the exercise intervention was treadmill, and they found that exercise did not increase systemic inflammation, once again, dispelling the myth that exercise could make an autoimmune or inflammatory condition worse. And overall, there was improved benefit in cardiovascular health. I think it's worth it just to mention a few other studies about in terms of exercise and other conditions that can occur with lupus. One of them is osteoarthritis. So osteoarthritis is what we think of as the wear and tear arthritis. Risk factors are age, being female, joint injury, and family history can affect one or multiple joints, and it likes to keep company with lots of other chronic conditions. The universal recommendations by all osteoarthritis experts is exercise is the first line of therapy to decrease pain and preserve function. The question then always comes up, what type of exercise? And the answer is whatever will be done consistently in terms of that prescription and you will enjoy. Low impact exercise is going to be the most beneficial, but low impact does not mean low intensity. And it should include some resistance component, even if it's aquatic. We have data about rheumatoid arthritis and exercise. So rheumatoid arthritis being another autoimmune inflammatory arthritis, it affects multiple joints. It may be associated with lupus, and the arthritis that we see in lupus often can resemble and mimic that of rheumatoid arthritis. So there are many parallels. So we have several studies looking at even high intensity resistance training in rheumatoid arthritis. This was one such study where they trained patients with rheumatoid arthritis with a high intensity resistance intervention. And they found that the patients who were in the intervention group, they got stronger, they got increase in lean mass, decrease in fat mass, and there was no increase in their RA flares. But this was an incredibly important part of that study, which was a 3-year follow-up. So they went back to everyone who was in the study and they said, 3 years later, how are you doing? You had all these great benefits from the study initially. How are you doing 3 years later? And they found that 0% of the patients continued to exercise and 100% of the patients had lost their benefits. And 100% of the patients had regained fat and lost lean muscle. So what this tells us is that the commitment to exercise, really, it's a lifestyle change. It's a lifestyle intervention. It's not something to do for a short period of time. So what about yoga? There was a nice study that was done actually out of Johns Hopkins that looked at yoga and arthritis. And what they found was that patients with arthritis who did yoga had improvement in pain, flexibility, and less depression. And once again, no risks associated with it. So before making a plan for the future, you have to acknowledge where you've been, just as we went through the history of exercise. So when I'm talking to my patients about exercise, we talk about goal setting. And so I'll just give you a scenario of one of my patients. So 25-year-old young woman with lupus, and we talked about her goal setting and what her exercise experience was. So before her diagnosis of lupus, she had done some cardio. She was a YMCA member. In the past 6 months, she'd done a little bit of neighborhood walking, maybe about 30 minutes per session, 3 days a month. She was really she was interested in increasing her fitness. And so she had been walking in a dedicated way recently. She's never done strength training. Her goal was to increase strength and to decrease fat. And we also spent time talking about, what do you like to do? Because if you don't like to do it, we're not going to make that recommendation. And ultimately, this was her prescription for exercise that I made for her. I made a specific referral to a physical therapist for detailed instruction and direct supervision in a progressive resistance training exercise. We talked about the joint concerns and talked about these with the therapist and how to manage them. She continued her dedicated walking regimen, documenting it each time so that it was structured, it was goal-oriented, and we knew exactly how much time she was going to spend on it. We discussed rejoining the YMCA after her physical therapy, and she had a progressive resistance training program that looked like this, where we gradually increased her resistance over time. There is a overview if you want some more information on what is out there in terms of a prescription for exercise in systemic lupus. This was an effort that was coordinated by Dr. Timlin, who's on this call today, that really looks at all of the recent data on exercise and lupus, but we still need more. As I close, I just want to share with you one of the most inspirational women that I think that there is, who is this woman here. And if you're from the Baltimore, DC area, you may be familiar with Ms. Ernestine Shepard. And Ms. Ernestine Shepard is the world's oldest bodybuilder. She competed as a bodybuilder at age 71 in her first show, but here's my favorite part. She did not start training until she was age 56. She is now 85 years old and still training at a high level. Age, chronic illness is not a barrier or a ceiling to what you can accomplish. So I would encourage you, if you're looking for some inspiration, follow Ms. Shepard. She is just a powerhouse in terms of exercise, fitness, and inspiration. So as we wrap up, exercise is good for our patients, exercise is good for doctors, exercise is good for everyone, but there's no doubt that some motivation is required. Whoops, what have I done here? All right, so in conclusion, a couple of summary points. So we know that fatigue and muscle weakness are common in lupus, but exercise is a safe and effective intervention. Our lack of knowledge in the healthcare provider community is a barrier for our patients and the prescription of exercise regimens. It is something that many of us in healthcare are trying to change and work towards changing, but I encourage and empower patients to be a part of this as well. A prescription for exercise should be specific, goal-oriented, and allow for progression. There are great tools and resources out there. The Exercise is Medicine website is one of them. There's still much that we need to learn about the best prescription for exercise in lupus and how to harness the anti-inflammatory properties. This is an area for research in the future. I encourage you to partner with your rheumatologist if you're in the Baltimore area. Dr. Homa Timlin is a lupus expert there, but talk to your doctor about what would work for you and how a prescription would be the best fit. And this is important. The last point is probably one of the most important. Circumstances may require a change in the formulation or the dose of exercise. Life is constantly changing. We're getting older, we develop new comorbidities, life circumstances change it, we get an injury. So the type of exercise you do may change, but you don't have to stop it. You don't want to discontinue the drug that is exercise. So I appreciate your time. I'm happy to answer questions during the question and answer session at the end, and thank you for the opportunity.
Thank you so much, Dr. Manno. That was so informative, and we have a bunch of amazing questions in the chat. We will sort through those and then jump to those at the end after we hear our next presentation. I am so excited to introduce Arnita Roberts-Christie, who is a patient engagement liaison from GSK. She will share the importance of exercise to your mental and physical well-being and share some tools with us all today. She's going to also be sharing her screen, so you can feel free to share your screen whenever you get a chance. I'm excited to hear your talk, and we'll sort through those questions.
Good morning, everyone. I am working on getting my screen together here and go from the beginning. All right, and move this over here. Actually, let's get that smaller. Okay. Well, I don't know. I have to say, Dr. Manno, I am not trying to be the act to follow you. I loved your energy. I loved everything that you said. And there are some really, really great questions in the chat that I want us to get to. So as Leanna said, my name is Arnita Roberts-Christie. I am a patient engagement liaison at GSK. And what that means is I have the honor and distinct humble pleasure of traveling around the country and educating communities about the disease of lupus. Now, we've been in this virtual space for 2 years, and I must admit that the virtual space has allowed us to reach many more patients as opposed to face, but nevertheless, I really appreciate the opportunity to be before you and for you staying on. I've been a registered nurse for over 35 years and in the space of immunotherapy for about 10 years now. However, although a registered nurse, my role here is to provide education. And so in terms of disclosure, I am not here to diagnose, to prescribe, to encourage any type of medication. I am here to encourage and empower you, the lupus warrior, to ask certain questions of your physicians as it relates to you living with lupus. So what we're going to talk about today for the next 15 to 20 minutes is living with lupus and managing the lupus lifestyle. Now that can be quite different for everyone. We know that on average, it takes you anywhere from 4 to 6 years for diagnosis. We're really working on early diagnosis because we know that that has an impact on saving our organs in the long run. So living with it, how do we manage it? Let's get started. And okay. One of the things I think is really, really important is talking about how the importance of your role in your care. And I love the way that Dr. Manno talked about that, you know, there should be a partnership between you and your healthcare provider because you know your body best. And our healthcare providers know how to manage us clinically best, but the two cannot work in two separate entities. They have to be joined together and work as a unit. And so I applaud all of you, all 58, 57 of you, for being on this call, for staying on and recognizing that your role is critically important to your healthcare. You're being an engaged patient. You're being an informed patient. Okay, let's try this one. And so what does it mean to be an engaged patient as you live this lupus journey? It means that you educate yourself, which you are doing here, educating yourself about your health, about exercise, how that fits into the whole globe of your journey. You are, I encourage you to communicate with your healthcare team. Now that team may be, you know, depending upon your age, maybe your pediatrician, your rheumatologist, your primary care physician. There is a whole team that you may have to help you as you're on this journey. But it's important that you communicate with each of them. If one of them decides to change the medication, you make sure that all of them know what that change is. We're going to talk a little bit further along in the presentation about monitoring and tracking your symptoms and the importance of doing that. And then again, taking ownership of your health and your lifestyle. I want to spend just a couple seconds on this, brain fog. What we do know, hold on one second. Okay, great. What we do know is that lupus can affect the very small microvasculature in your brain. And that can sometimes manifest itself or show up as a terminology we've been given as brain fog. That can mean that you, the warrior, can become easily confused, have challenges with memory, as well as an inability to concentrate. And if there are any caregivers on the phone on this line, I want to just share a brief story with you. I was and someone had mentioned Boston. I was doing a presentation in Boston a few years ago, and it was a mother-daughter team that was in the audience. And as I began to talk about brain fog and talk about, you know, anywhere from 50 to 80% of those living with lupus can experience this, and that it can be something as straightforward as the doctor comes in, says, Arnita, I want to see you back in 2 months, and then the doctor walks out and the nurse walks in, and the nurse says, when does the doctor want to see you back? And I give a blank stare. Well, I don't remember. Or there was so much external stimuli going on that I got confused. That is very real. And so this mother-daughter, as I was describing this story, the mother looks at the daughter and says, so you really don't remember when I share something with you? And the daughter says, no, Mom, I've been trying to tell you. The mother thought that the daughter was just being difficult. But this is very real. So I don't want you to minimize the fact that this can occur for you, and caregivers, if you're on the line, that this can affect your lupus warrior. Hold on, computer, there we go. Okay. As part of GlaxoSmithKline or GSK, we have what's called an Us and Lupus community. And it is a Facebook, it is a Twitter, it is an Instagram. And what people do, what lupus warriors do, is come into this community and they document different information. And there often is a translation or a back and forth between a lupus warrior and another lupus warrior, giving words of support, words of comfort, words of encouragement. This particular visitor said, it is, referring to lupus, it is definitely an invisible disease. Through it all, we have to keep pushing. And I do encourage the keep pushing, to keep pressing forward, to keep moving along the journey. Talking about symptom tracking and its importance of it. So what I love about this, what I love about this picture here is this young lady. As I think about lupus and the journey, and all of us that are maybe on this journey, the different ages, the different lifestyles, this young lady reminds me that, or encourages, because I'm a more mature woman, that, you know, you can take notes on your cell phone, smartphone, whatever that device might be, whereas some of us like to write things down or keep a calendar or a notebook aside. The importance about symptoms is that you start somewhere and tracking it, because what that does, you tracking it, you having some way of documenting how you are feeling, is that you can take that information with you to your healthcare provider. As I mentioned a couple slides before, that brain fog is very real. And so you may not remember what you did yesterday. Sometimes I don't remember what I did yesterday. And certainly what I did from the last visit, how my health was from the last visit to the current visit, I may not remember. However, if I wrote something down, if I tracked it, that will help. And it also can help you to practice how you might want to communicate with your healthcare provider. Some people might say, you know, I don't say a lot when I'm in the doctor's office because I don't know how it will come out, or I may not use the right words. But you can use symptom tracking as a way to practice what you want to say before you go to the healthcare provider's office. Now, health journaling is a little bit different. It is a part of symptom tracking, but it's looking more at your diagnosis journey. What medications are you on? What milligrams of the medications? How often are you taking it? Has that been a change from your last visit to your current visit? Have there been any new triggers for your lupus as you are on this journey? Did something happen where last 3 months, a certain week of the month, you noticed that you were a little bit more tired than you were in the previous 3 months? Let's look at that and see, is there something else that might be triggering of new flare? What about your mental state? What about your emotion? As we're still in this social distancing arena, and we are lightening up that in different parts of the country, but that really has shown to have an impact on our mental state, whether you are dealing with a chronic illness or not. It has impacted us. It has impacted us in a not so positive way. And so how are you dealing with that? What are coping mechanisms that you've put in place to help you along that, in addition to what you're doing as you're living with lupus and on the lupus journaling? And so how can health journaling help? There has been information and studies that have shown that when we express ourselves, whether we are writing it down or we're typing it into whatever, electronic device that we have, that it is an expressive way of getting out what we sometimes keep bottled up inside. We know that when we keep things bottled up inside, that can negatively impact our health. And so over time, your health journaling can give your physician, your healthcare provider, a more accurate picture of how you are feeling in a holistic sense, how you're feeling physically, mentally, spiritually, as well as psychologically. The important thing, however you do it, the important thing is that you start, and that you start somewhere. You find a format that works for you. You can start with your history, your health history, your goals. You can make it a routine. Some people say, well, I forget, Arnita, I forget to write down. Well, let's say you get up in the morning before you put your feet on the side of the bed. How about taking out a pen and paper or grabbing for your phone and just jotting down some notes? But the important thing is that you start somewhere. I talked a little bit about your healthcare team and how important their role is in that, really connection between the two of you. Listed on the screen are a number of different healthcare team members. It is not an exhaustive or a complete list, but these may be the different healthcare providers that you have involved in your healthcare and that are on your team, that are here to help you be engaged, here that you need to communicate with, here to help you along your journey. Dr. Manno said that she wasn't going to talk about nutrition, and this is not a nutrition talk for me, but I too want to mention the importance of nutrition. I've listened to a number of different nutritionists who say, quote unquote, garbage in means garbage out. So if we're not putting in the healthy foods for our bodies, our cells are not able to use those healthy nutrients to help us live the life that we want, or even to exercise the way that we want, to even give us the mental stability that we want. So I encourage you to put in healthy foods. There's an orange or a yellow pepper there. There's some vegetables there. Make this a family event if you can. If you are living alone, use your social media if you can to talk to someone while you are cooking. See what they're cooking. Hey, I'm doing fruits and vegetables. Well, what fruits and what vegetables are you using? Another thing I'd like to share is when you are grocery shopping and you go into the grocery store, the outer aisles of the grocery store is where you will find your most nutritious foods. If you're using the inner aisles of the grocery store, that's where we're finding our more processed foods, foods that do not have as much nutrients that our bodies need or that our cells need. So I encourage you to shop on the outer aisles of the grocery stores. And if you need assistance with, Arnita, what do I buy? Well, I can tell you, I can share with you that, fried foods are not going to give you as much nutrition as baked or broiled foods, or foods that are, have really rich colors like your reds and your yellows and your oranges. But if you have questions about that, I encourage you to talk to your healthcare provider, and perhaps they can recommend a nutritionist or someone that you can talk to help you along that journey. As we're talking about lifestyle, I love this picture because, as Dr. Manno had said, it's not always about what you do, but it is about that you do something. We've been in this pandemic space and we've sat on the couch a little bit longer. We've binge watched certain shows. How about getting up as you're watching a show and then walking around inside your apartment? If you can't walk, you're sitting, moving your knees up and down, stretching out your arms, moving them, doing some bicep curls, stretching out your arms, doing some triceps. But the important thing is, before you do anything, talk to your healthcare provider. I want to start moving. What can I do first? What do I need to be aware of? Staying active, being active is more than just exercising. It's getting up and moving. We've heard about the importance of, you don't have to run a marathon. You may not even need to walk a couple miles, but what is important is that you move. Activity is important for both I believe it was our first speaker, Rebecca, that talked about how moving and physical activity not only helped her body physically, but it also helped her mentally. And so it helps to strengthen your body as well as your mind. You don't have to do something specific. However, I did learn today that it needs to be structured. It needs to be goal-oriented, and it needs to allow for a progression. So in consultation with your healthcare provider, think about your goals. Talk to them about what goals that you want. And then explore those. If you are in the midst of a flare and you say, you know, Arnita, I cannot walk the 2 miles today. What can you do today? Let's look at what you can do as opposed to what you cannot do. I cannot overemphasize the importance of sleep and how restorative that factor is for your body. It can help with your metabolism. It can help with your weight. How much sleep do you need? Talk to your healthcare provider about it. But if you have the opportunity and you can be on a weekend and not put your alarm clock on, see what time you really do wake up. And that may tell you that your body may need a little bit more sleep than you've been giving it. What you want to do is set the stage for sleep at night. Turn off your television, your electronic devices, decrease that rays of, that may be coming from those at least an hour before you want to go to sleep. Be mindful that you can take a nap, and that nap can be any less than 60 minutes, but not very close to the time that you want to go to sleep for a long period for your night. I'm in the home stretch. As I'm in the home stretch, if you have a smart device, whether it be your phone or an iPad, I'm going to put up some QR codes that you can take your phone right up to the computer and go to our Us and Lupus website. So I'm getting you ready and gearing you up for that. But as we are approaching these summer months, as some of you have indicated in the chat that you are marathon runners or you are really heavy walkers, I want to encourage you to be sun smart, to put on the extra sunblock or, that you might need, to wear a big floppy hat, to wear long sleeves or long pants, to make sure that you are using the proper coverage that is needed as you are in the sun. Mindfulness. Dr. Manno talked about yoga. I love this section because it encourages you to be present to right where you are. This journey that you on is not an easy one, but be mindful of your thoughts and your self-talk. Oh, I can't do 3 miles today. Well, let's talk about what you can do today. Let's be present to where you are. Yes, you might be in the midst of a flare, but be present to say, I can do this today. I may not be able to do that, but I can do this today. And the key is to be present, to accept where you are and to accept where you are without judgment. There are a number of different websites, a number of different apps that you can look up on your phone to do some mindfulness-based stress reduction. Dr. Manno talked about yoga and how that helps with movement for those that may experience arthritis. That also has an impact on not only your physical benefit, but also your mental. And so as I begin to close, self-appreciation, having a chronic condition requires a lot of self-love. If you haven't received a hug from someone lately, take this opportunity, put your arms around yourself, give yourself some love, give yourself the understanding that this is not an easy journey. However, you're going to love your way through it. You're going to press your way through it. Know that it's ever changing, and you are going to do what you need to do to be with the change. As I promised, this is a slide that I really would like you to take your phone and put it up to. You can start with the very far right, my very far right, which is talking about receiving a guide to lupus in uncertain terms. If you take your phone and put it right up to the screen, it will open up. There will be brackets around it, and that will take you right to the Us in Lupus website.com website. You'll need to scroll up in order to put your email address in order to receive this guide. There are tips to talking about lupus, more information about how to live with lupus, and then information about symptom tracking, which I talked about earlier. It also gives you the opportunity to download a number of different resources. And so please take out your phones if you haven't done that already. And then I will move to our last. If you haven't been able to get your phone, you can also always go to usinlupus.com. That website will be there for you. And I want to thank you for listening, for staying there. And I want to get to those questions. There were a number of different questions that were awesome in the chat. So thank you for your time and your attention.
Thank you so much, Arnita, and definitely everyone. Those resources she shared on the QR codes are wonderful. So please make sure you find those, and we'll share those as well in the post-event email. There were a ton of questions in the chat, and I'm not sure if Dr. Manno, you got to scroll through them, but I can start by kind of summarizing a few if you want. So a lot of the questions had a common theme of how does the benefits of exercise and the different impacts of exercise when you have lupus and another disease. So a few people mentioned fibromyalgia and scleroderma, but I wanted to throw that question over to you first.
Sure. So the question being lupus plus another condition. So I'll address the lupus plus another condition if that other condition is, say, scleroderma or myositis first, because we do have quite a bit of data on both of those conditions in exercise, especially myositis. And we know that lupus can affect the muscle specifically as well in an inflammatory way. And with scleroderma, it is not so much an inflammatory muscle issue, but more of a fibrotic one. And sometimes when the muscle is involved, our inclination is don't use that muscle, you're going to make it worse. And the complete opposite is true. So much so that now in the world of inflammatory myopathies or inflammatory muscle disease, exercise is at the top of the list. We know that we need to exercise that muscle. So having lupus plus another overlap syndrome, such as myositis or scleroderma, is not a reason not to exercise. But once again, I wish I could tell you there is a universal, this is the one size fits all. It's not, but that's what makes it so effective, because it should be personalized to you. So if you have one of these overlap conditions that specifically targets the muscle, then that resistance training is going to be even more important for you. So getting to the second part, which is if you have chronic pain from fibromyalgia or another chronic pain condition, how does that influence exercise? And that it absolutely can be tricky, because as many of you know, if you're living with fibromyalgia, it is this balance. Pushing too much can cause extreme flare, but not moving at all is going to make the pain worse also. So similar, it's finding the right balance. With my patients who have fibromyalgia, I always start off with the most low impact exercise that we can. These are going to be things that are going to focus on range of motion, mind-body connection. Tai Chi, we know that there are data that have shown the effectiveness in fibromyalgia. So that is going to be my first level of go-to in a patient with lupus and fibromyalgia, and then gradually build up from there. I will also often recommend aquatics or being in the water, preferably warm water. So and that's important because cold water is not going to be good for the joints and for the muscles and so on, but warm water. And I recognize that everyone doesn't have access to that. But if you do, take advantage of it, because it is a great place to work on, especially if you have concurrent fibromyalgia, is a great place to work on just getting started in terms of range of motion exercises. And even so, and just another word on aquatics, sometimes a myth about aquatics is that you can't do good resistance exercise in the water. And that is not true at all. It's a great place to do resistance exercise. There's also these really cool weights that you can bring into the water as well to increase your resistance. I'll often tell people just walking in the water. So we are lucky here in the Caribbean. The water is starting to warm up now. So my patients are going to the beach more often. I will encourage them to walk in the water, horizontal to the beach, and just walk in the water because they have the buoyancy of the water, but the resistance as well, because they're going against the current. And it is a fantastic way, especially if you have chronic pain.
Perfect. Thank you so much. I think that was really great advice and some tips for everyone here. Another common question that came up was UV sensitivity. So if you could touch on that a little bit.
Sure. So first of all, bravo for a couple of people brought up that question, and hooray and bravo for recognizing the importance of UV sensitivity and trying to avoid sun as much as possible. So of course, that is going to limit or change your outdoor exercises. And once again, being in the world of where I am now, of lots and lots of sunshine, this issue comes up quite a bit. Having said that, I encourage people to wear, sunscreen is great, but realistically, you can spend so much time lathering your whole body in sunscreen, and then it's messy and it's greasy, and the world of UV protective clothing has come so incredibly far, and I strongly encourage UV protective clothing. And so much of it is great for exercise because it wicks away moisture and it is sun protective. And you can get everything literally, and maybe this is because I have access to this because we are in the world of sunshine here, literally from head to toe. So UV protective hats, UV protective neck guards. So a lot of people, even who are not UV sensitive, but are out on the water and doing boating, will use UV protective neck guards, hat, of course, and then long sleeves and pants. So if you really are enjoying the outdoors, I would say UV protective clothing is going to be your best friend. Otherwise, bring the exercise indoors the best that you can.
Awesome. Thank you so much. I also want to let you guys all know that if you are interested in learning more about skin and lupus, we do have a Lupus MU next week on skin and hair loss. I can share that link with you guys all in the chat and in the post-event email as well. I think we'll touch a lot more on UV sensitivity, rashes, and all those topics, because I know we received some question on body rashes with SLE. I'm not sure, Dr. Manno, you want to touch on that, or if there's any other questions you saw in the chat that you wanted to flag today, but I think you covered a lot of the really big topics that people were questioning.
So I'll mention two things really quickly that I just saw in the chat. One is Vivian asked, how do you know what UV protective clothing is? And it usually has a label on it. So it literally should say, and if it doesn't say UV protective clothing, that it's UV protective, do not assume that it is. So it should have a label on it that says that it is an SPF, whatever. So, and if it doesn't, like I said, don't assume that it is, because you don't want to be wrong about that. There was a question I think I saw in the chat that I'll just mention briefly about rashes and the skin and exercise and skin irritation with exercise. And I think it's an important observation, and it can be certainly challenging. And sometimes that can be the association of friction from clothing, of course, being irritating. And so I would say wearing the most non-irritative clothing in areas that are rubbing as possible. And I think the question was also about sweating. And so when they sweat, the skin becomes irritated, and the sensitivity of the skin, especially if there were areas that have had intense rashes in the past. And although sweating sometimes is a part of exercise, and it can be challenging to say, well, just don't sweat. But what I would say is low impact exercise may be the best choice in that situation. And what I mean by low impact is going to be exercise, especially isometric and body weight resistance exercise. So this means that you don't need to have high velocity, high repetitions. Isometric exercise is when the resistance is coming from time of the muscle under tension instead of a range of motion or moving a particular weight. So an example of this would be wall squats. So if you stand up against the wall and then you lower yourself down like you're sitting in a chair, but you don't sit in a chair, and you stay there for 30 seconds. You'll find as time passes, it becomes harder and harder and harder to stay there. And then you release the muscle. So it's time instead of movement. And sometimes with the rashes or the skin irritation that you may be getting, and this may not be universal for everyone, but this is just a suggestion, it can be because of that rubbing or that sweating and that movement. So you can still exercise, you can still challenge the muscle, but minimize the movement.
Perfect. Thank you so much. And I'll have one final question, just more focused on the exercise topic is, someone asked, please address the proximity of exercise and infusion medication.
So I would say that there's no absolute recommendation. I would not tell my patients who are, let's say they got their belimumab infusion and then they want to go running that afternoon. Okay. If their body feels okay with it, for some patients after maybe they've gotten their IVIG infusion, they feel like they need a 2-hour nap. Take the 2-hour nap. Don't force yourself, take that day off from exercising. So there is no absolute contraindication to exercising after an infusible or injectable medication. There's no absolute time frame that you would have to wait before being physically active again. But recognizing that everyone responds differently to these medications, and if your body needs some time frame to recover, that's okay. You're not harming yourself by not exercising. In fact, you're going to make your next exercise session more beneficial because your body's going to be ready to do so.
Perfect. Well, thank you so much. I'm going to go ahead and wrap that up. And if anyone has any additional questions or follow-up, you can please reach out to me at bennett@lupus.org. I'm just going to share my screen again real quick to share our post-event survey. So thank you to everyone for joining us this morning. And thank you so much to our speakers for providing great insight, resources, and tools for everyone. I know I personally learned so much. If you guys hold up your camera to the QR code, you can find our post-event survey, and I think I put it into the chat. The feedback is so highly valued and helps shape our future programs. So I'd love to know what you thought about the program today, and I'd love to hear more about what type of content you would like to hear for the future. It will really help us moving forward to plan more content specific to what you guys would like to hear moving forward. As I mentioned earlier, we do have another great program scheduled for next weekend. So April 30th, same time as this, so 10 a.m. to 11:15, we'll be just discussing skin and hair loss. Dr. June King will discuss skin and hair loss. Arnita will be back sharing another wonderful presentation, and we'll have another amazing lupus warrior share her journey with this topic. So thank you again to all of you for joining us this morning, and again to our wonderful speakers. I hope you guys have a wonderful rest of your day and a wonderful weekend. And thank you again, and I will talk to you all soon. Bye-bye.